Hello everyone, welcome back to this session. In this video, we will continue from where we stopped in our previous session. Before that, let's remind ourselves of what we discussed in the previous session. We defined advanced geriatric care in clear, clinically relevant terms. We differentiated normal aging changes from pathological processes. And we explained how aging alters physiological reserve and why this limits compensation during illness.
By the end of this session, you should be able to 1. Describe why disease presentation is often atypical in older adults and why early escalation improves safety. 2. Identify and apply functional decline and vulnerability concepts to basic clinical scenarios. We'll continue by looking at why presentations are atypical in older adults. In geriatric care, function is a vital sign. Early functional decline may present as new difficulty walking or transferring, increased falls, reduced ability to perform daily activities, new confusion or withdrawal. These changes often precede abnormal laboratory or vital sign findings and should trigger urgent clinical assessment. Next is what vulnerability and functional decline look like clinically. Vulnerability arises from the interaction of reduced physiological reserve, multimorbidity, polypharmacy, cognitive or sensory impairment. This explains the high risk of delirium, falls, adverse drug events, and hospital-associated complications. Understanding vulnerability enables early proportionate intervention. Now we will move on to see how advanced geriatric clinical reasoning work. Geriatric clinical reasoning emphasizes change from baseline, functional and cognitive assessment, anticipation of deterioration, early escalation. Rather than asking, "What disease is this?" advanced geriatric care asks, "What has changed? Why is this dangerous for this patient? And what is likely to happen next?" In summary, reduced physiological reserve in older adults limits their ability to respond to stress, causing rapid deterioration and prolonged recovery even from minor triggers like dehydration or infection. As a result, these conditions often present atypically with early functional decline, requiring geriatric care to focus on recognizing changes from baseline and anticipating risks to enable timely intervention. That's it for now. Thanks for watching. See you in the next session.